Hello, welcome everybody. My name is Stéphane Brutus. I'm the Dean of the Telfer School of Management. Ça me fait un grand plaisir d'être avec vous aujourd'hui pour cet événement qui a pour but de discuter d'un enjeu extrêmement important pour la société de nos jours, les enjeux de santé, des enjeux qui sont extrêmement importants pour l'école Telfer. Today's event is part of Telfer's vision for a better Canada, and a better Canada is also a healthy Canada. You probably heard in many communication that we've sent to you the new vision for the school for a better Canada, and you can hear it from the Dean. The health focus of Telfer is extremely important in the strategy of the school. I will now introduce our moderator for today, Dr. Mirou Jaana, who is a full professor at Telfer, as well as the new MHA Program Director at the Telfer School of Management.
Thank you, Dean Brutus. And without further delay, I'm happy to introduce to you our speaker for today's session, Cameron Love, who is a graduate from the MHA program in 1997. Cameron is the president and CEO of the Ottawa Hospital, one of Canada's leading academic health services centers. He took on this leadership role as of July 1st, 2020, just in the middle of the action, in an unprecedented time as Ontario's health system adapts to a new service model in the wake of COVID-19.
Good afternoon, everyone, and thank you for having me here today to talk a little bit around taking on this role in the middle of a pandemic. My name is Cameron Love, and I've been in Ottawa now since 1998. I've been at the Ottawa Hospital now for over 20 years. And when I think back over the last sort of couple of decades, a huge portion of our focus has been really around building out the programs and services that are at the Ottawa Hospital. But over the course of the last year, when I became President CEO, which was at the end of June, I was fortunate because the announcement of the CEO was back 6 months prior to that. And so I had a chance to spend a fair chunk of time working with our board, our senior leadership team, really around thinking about what are sort of the key areas of focus that we're going to move towards as part of our vision. And one of the big elements to this, and while it was right in the middle of the pandemic, was really focused around not only building capacity, value, innovation, research, but really around integrated care models, and really focused around how we build service lines that span the entire continuum of care. And in this region, from an adult care perspective, we provide about 70% of the total adult acute care, but 100% of everything that's complex in nature. And when you look across Canada, Ontario, I think, is starting to move in the direction of trying to think about how we integrate and regionalize services through Ontario Health and Ontario Health teams. But compared to the other provinces, there's a lot of room in terms of how we start to look at an integration mandate. And the reason I raised that is, as we moved into the pandemic, what we started to see was a lot of movement under a crisis scenario of how we try to manage care, not in the siloed fashion that we've historically had in Ontario between acute care and post-acute care and community care and so on and so forth, but very much in a sort of an incident management structure that is really focused around integrating care. And so what I thought I'd try and speak to a little bit today is that context of what we lived through over the last year and a balance between taking on the leadership role during the pandemic and some of the lessons learned that I've seen through the year. So with that context that I said, I think there is no question if you look in Ontario, definitely within Ottawa, and you go back to February, historically in every winter, we are under significant duress with just not anywhere near enough bed capacity just to deal with general demand. Hospitals typically are running at 100, 105, 110, 120% occupancy, challenges with long wait times that emerge, canceled surgeries, et cetera, which is not uncommon across large centers across Ontario, and I know it's the same across many other provinces within Canada and quite honestly in other parts of the world. But as we looked across February and we saw what was coming out of Wuhan, the travesty that they had that hit Italy, it wasn't until it's hit New York, and I think there was a bit of a perspective that maybe, you know what, North America would dodge a bullet on this one. But as soon as New York hit, we saw a very significant amount of validated angst that started to occur of the fact that it was definitely North America. We started to see first cases in Canada. And the big concern was at that point was, are we going to have what New York was facing? We'd have literally hundreds of ventilated patients in the ICU. So that was really the first foray into this, which was to create very rapidly over about a 2-week span, somewhere between mid-Feb and the beginning of March. How do we create a capacity plan? And if we have to ventilate at TOH about 200 ventilated patients and maybe have upwards of 200 on acute care units, how do we build that capacity? So there was directives issued by the province, and we spent a lot of time over those 2 weeks pretty much getting ready to be able to do that. And by the end of it, we had closed down huge portions of the organization to be prepared for that. But thankfully, as we got through wave 1, we never saw that. Having said that, the other piece that has been a common thread through this entire pandemic has probably been personally one of my biggest concerns is just the sustainability of the workforce. And I think in that first wave, it was probably the time where we had the most level of anxiety, because you see reports in terms of healthcare workers dying, people not really being sure, is this airborne or is it contact precautions? How are we going to keep people safe? How do we even manage the disease, which was new to everyone? And so those first 2 or 3 weeks was just a huge amount of instability of getting educated and prepared for our workforce to be able to manage what we thought was going to be a huge portion of COVID. And that probably occupied the better part of 2 months worth of time. And in a place like ours where we have 15 to 20,000 people working, it was probably the number one thing that was of greatest concern, ranging from supplies to staffing to being able to manage. We had lots of sick calls, and I don't think that's any different than what the province of Ontario was facing, and probably all of Canada. But it was a huge issue within our walls in terms of trying to create some calm and some stability. I think the other thing that was probably the most refreshing component of this entire pandemic was how people really dropped sort of historical either governance or money or concerns of those types of things, and it really became a very collaborative approach. And so between public health, all the hospital partners, community health centers, City of Ottawa, there were structures that were put in place, but people were really, really, really good in terms of just working together to figure out how we were going to collectively get through this. And it was a time where, and we see this a lot in disasters that tend to be short-lived, whether it's things like the bus crash we had a couple of years ago, where people more or less drop everything to provide that support. And so we saw a lot of that. And quite honestly, I think it's probably the silver lining that got us through the entire last year in terms of how, as a community, we've rallied. And then I think the other thing that is a little foreign to healthcare for a large part is the pace by which decisions were being made and continue to be made even up to today is a little bit foreign to healthcare. I mean, a lot of the times for major changes we're going to make, you take months, if not years, to work through them and all sorts of data and those types of things. We had directions being issued pretty much 2-3 times a week. And so you're making a lot of very rapid decisions very quickly to be able to stabilize and manage. And that's a different mindset than what we're historically used to. So I want to talk a little bit around what I saw, or my perspective of what occurred from a leadership perspective throughout this. And there's elements of this that we've seen before. I think we're going to see after, and we definitely saw it during the pandemic. But I think probably the most important thing, or the biggest lesson I saw through this, was you can have lots of protocol, you can have lots of policy, but the reality is at the pace we're moving, this whole framework of success through the pandemic was built on relationships. And so, coming into this organization as a CEO, thankfully I'd been here for 20 years. So, I mean, I know everybody in this building, I know the hospital very well. But having worked with many, many people over 20 years in this region, whether it's CEOs or chiefs of staffs or counselors or anybody in between, we had a lot of people sort of rallying and putting structures together very quickly and figuring out how we manage through this together, both internal at TOH, but predominantly externally in terms of how we're going to manage as a region. But then you've got IMS structures that are organized in Ontario Health, the Ministry of Health, the province, and the feds, as well as the City of Ottawa. And so the reality is that while we had a lot of formal structure, a lot of things were being done informally in the background, and those relationships are absolutely critical in terms of being able to manage collectively as a community to move through this. Because it really isn't about, in this pandemic, while a lot of pre-pandemic is you look at what you're doing organizationally and you have a lot of discussions of what you can do as a region. During the pandemic, It's not about the organization, it's about the system and how we manage the system and all aspects of it. And the number of meetings that occurred just off the record in terms of trying to move things in certain directions and get submissions in and build capacity was fairly substantial for the first, well, it's been the whole way through, but particularly the first 6 to 8 months. The other thing I'd say that is really key in this is there is a real danger in the middle of these things is you get caught in a swirl of being extremely dramatic and negative about everything. And I think part of being in these leadership positions, and this is for, when I say leadership positions, it can be CEOs, it can be directors, managers, our department heads, is how do you keep and maintain stability, positivity, and some hope? You know, probably the best line I've heard through this entire pandemic was from our chief of staff about 2 months ago. And her comment was, she's an ID specialist. She's trained in pandemics for years. It was part of her thesis and her studies and she's a great ID physician. Is the reality is with all pandemics over the last couple of centuries, just like all major infectious disease outbreaks, the one thing they have in common is they all end. And so a lot of what we've spent a huge amount of time as a leadership team on is maintaining perspective and keeping some calm and positivity on this, that we're going to get through this. Because what people have faced in terms of not only in work, but I think particularly outside of work, where people have lost loved ones, spouses have lost jobs, they're concerned with their kids and their safety of their kids, can't see their parents. All those things are significant stressors, and you can quickly lose perspective and positivity, which starts to create some instability within organizations. And that's been a bit of a driving force for us the entire way through, which is really the engagement of our entire leadership team. Teamwork is the other thing. There's not one person that can manage through a situation like this. In a place our size, even outside the pandemic, teamwork is probably the underlying principle and value that we have. During a pandemic, you got a lot of people doing a lot of different things based on their skill sets. And so you end up putting in a lot of temporary or interim structures just to be able to manage through this. And you're really relying on people's initiative, leadership, and diversity on skill set. And up to this day, even with where we're at in wave 3, we continue to do that. Aligning and facilitating decision-making, I call this the 80-20 rule. And we've really seen this in the pandemic. I'd suggest to you that just in general, even pre-pandemic, if you implement a change and everybody's happy and 100% of people agree, you probably haven't changed too much. And if you have, you've created a solution that's probably not to the greatest benefit of the system. And what we've seen through the pandemic is it doesn't matter what decision you make, there is always 20% that either are concerned, completely disagree, and are either going to push back fairly hard, or are going to create other ripples in terms of rallying other groups. And you know what, fortunately, we haven't had a huge amount of that. But I think part of that is really engaging that 20% to spend a lot of time in terms of trying to get them either on board or understanding why those changes are being made. And that can be from, you know, the cabinet premier level all the way down to, you know, frontline individual organizations. And so a lot of this is trying to align and educate people and facilitate decision-making for decisions that are actually not made by the organization. Vaccines is a perfect example of this. Visibility and communication is like everything. Communicate. We've hold town halls every Friday, have for a number of months. We push out communications twice a week. We're out talking to our leadership teams all the time and trying to have visibility in an environment where you can't really have visibility face to face. And so you're bound by these Zoom calls and Teams calls and other things. So it's really finding different ways to create visibility and reassurance and hope while you continue to communicate everything going forward. And then I think the last thing is resilience and balance. You know, as and I know a number of you are from other larger sites as well, from across the country, but there are, as the regional trauma center, we're pretty used to having significant events where we have to rally very quickly in a trauma situation. So if you take something like we had the bus crash, as I mentioned, or there was a bus train accident or tornadoes where you've got a lot of injured coming in, our teams are very used to ramping up very quickly, dropping everything, getting it organized, getting people safely managed and cared for, and then taking it down. The big difference with this disaster is it's not 72 hours, it's 15 months, and it'll probably take 24 by the time we're done to truly come out of this thing fully and get back to a full level of normalcy. That is a very different run rate of getting our leadership team and having the resilience to manage through this on a continuous basis of supporting staff, 10, 12, 15,000 staff. And so a huge portion of what we have really focused around is around wellness and that balance that people need to try and maintain that level of positivity and energy to support the workforce. And there is a huge element of resilience, and it's not that everybody gets painted in the same brush. Some people are tremendously resilient, some are not. And it's not that they're better or worse, it's how you help them manage through it. And so we've spent a tremendous amount of time on this wellness and balance, because the reality is healthcare is driven by people. The only reason TOH is successful in what we do is because of the people that are leading within it and are doing the day-to-day clinical care and academic care, or academic work and education. And so if we don't have that workforce well-balanced, well-aligned, and well-supported, your core mandate starts to really get a little bit shaky. Across the board, one of the lessons learned is the importance of it, and it's been done tremendously well. And I think there's always ways to improve communication, but I think that's one of the big lessons that I've learned, at least at TOH, is it's one thing to communicate. It's another thing to communicate very clearly and very transparently and not try and sugarcoat things. And that's pretty much the approach we took from day one. This fifth bullet is probably the most important thing. Leadership is the key to all success. And you see, there's a great line that I heard, it's probably 2 or 3 months ago. And it was from just a committee meeting with someone that was chatting in advance of the committee meeting on one of these Zoom calls. And what he said was, the reality is unfortunately in the middle of a pandemic, or fortunately, you see the best in people and the worst in people. And that, thankfully, I think in this community, I think for the province and probably in the country as a whole, we've seen some incredible leadership. And the reality is you don't get through without that type of leadership. And yes, there are some that just are more challenging throughout this, but it's the small edge of the wedge. And I think it is the key. When I look in this organization, what our managers, our department heads, our directors, our VPs, frontline people, the way they've stepped up and agreed to help has just been unbelievable. And it really speaks to just rallying and leadership to keep people supported throughout the process. On the flip side of that last bullet is probably one of my biggest concerns, be the top 3 concerns I've got. There is no question it has been a tremendously long haul for the healthcare workforce. I can only speak specifically to my hospital, but I know for sure within other hospitals and within home care and others, this has been a really long run for people. And so we started about 6 to 8 months ago, on a real focused wellness campaign. And a program, we brought in some people to help build some programs. We're using some of our psychologists and psychiatrists and behavioral therapists to provide that support structure. And so we've really changed our thinking around wellness and how do we create a balance between work life and home life and what people are going through. And we've seen a lot of unfortunate cases on how we've had to support people through this. I think the key thing on this is let's say the pandemic is done and we're back into a green zone by the end of August, and we're back into recovering and we're ramping up all services. That does not mean that everybody's going to be well. I think there's some lasting effects, particularly when you talk about mental health, that really need to be rethought of. And so part of what we are doing is rethinking how we create a far different approach by which we manage wellness and support the workforce. And when I say workforce, it can be a housekeeper, it can be a neurosurgeon. They're all people. And so myself and our chief of staff, Dr. Roth, we spent a lot of time with our board on how we roll these out. So we've had a couple of meetings, we've got a retreat, we've rolled out 4 or 5 programs, we're putting some investment into this. And I think it's a common thread throughout the entire industry right now on if we're really going to recover from this. This is probably the key thing to focus on. So I think, Geneviève, I think that was it. So hopefully that provided everyone with a little bit of context of what my last year has been like, and I'm happy to take any questions, Mirou.
Thank you, Cameron, for the insightful presentation and for sharing your experience with us. I think I can speak on behalf of everyone in terms of recognizing the pressure that the hospital and the healthcare professionals have gone through during this pandemic, and we certainly appreciate a lot all the effort that was done. I will start going through the questions. The first question is, what practical advice would you offer to leaders in the healthcare system to help people be champions of their departments, silos, and the larger entity or system for the greater good? This pandemic is demonstrating our global capacity of people to flex, collaborate, and get the job done. What practical advice would you share to enculture this mindset and behavior throughout recovery and rebuilding phases? Thanks to you and the entire Ottawa Hospital team.
So the advice I'd offer to leaders is, the reality is leadership is very much driven by sort of that energy and that positivity to want to drive change and to innovate with a spirit of collaboration and teamwork. And while that sounds sort of motherhood and apple pie-ish, the reality is for the leaders that I've seen that have really excelled in this, it's built on that foundation of values. And so what I find is you take a leader that you give a program or an objective or a direction that has that, all you basically need to do is give them lots of rope, because they tend to run with it, and it's what creates that innovation and creativity. So, if I take, for example, when we went into the long-term care, you take Sylvia, what you just need to do is enable them to have that capability and that accountability to be able to develop that. And so I think part of what is going to probably have to shift over time here, if I'm understanding your question correctly, is part of that is finding the right leadership, the right leaders for the right roles within the right structure, and starting to create the models that I just referenced with something like nephrology with Ontario Health, that starts to create leaders that are thinking beyond the scope of their organization, and focus more around either service lines and or populations. And when you look across the country and you look at places that have truly regionalized, that is in essence what they've done. We don't look at how we manage care within a silo. We look at care across a continuum and to create leadership opportunity for that. And so while it's easy to say in a couple of breaths, if we keep in that direction, it's finding opportunities like we've done, and many others have done many other great things as well around what we're doing with long-term care, what we're doing with surgical care. If I use that as an example, we're running surgery now in partnership with a number of other centers where our physicians, it's one integrated medical model. We're moving towards discussions around administrative models. And it's to the benefit of the patient and family from a value and a quality perspective. But it comes back to finding the right leaders that are really willing to drive that. And the last comment I'd make on that, huge portion of this, and I think we're very fortunate as a community, this is not just about administrative leaders. A bigger chunk about this is around medical leadership. The leadership we've had from physicians through this entire pandemic is absolutely stunning. Like, it is a lot of why we've been successful with what happened in long-term care. The number of physicians that stepped up just to take the bull by the horns and run with this and actually create models out of it has been absolutely fantastic. And that's part of the reason why I think Ottawa's had some success through this. So I don't know whether I've answered the question specifically, Mirou, but that's how I'd respond.
Thank you. The Ottawa Hospital had to make difficult decisions to reduce services in areas like surgery. How will you bring these services back, and do you have the bench strength to do so?
Yes, and yes. So when I talked about access to core services at two sides of the coin, the access to our surgical services has probably been one of the biggest concerns, our being the royal we across the province. We have a backlog now of about 20,000 surgeries. And it is a massive concern. When you really think about population health, I can guarantee you right now with our surgical leadership, they make sure everybody gets in that truly needs emergent and or urgent surgery that's going to impact definitely on mortality and morbidity. But when you take things like cataracts and hips and knees and other types of general surgical or urological types of procedures, that backlog is a huge concern. And so part of what we have done is we're putting our plan together now, which is being done with our regional partners, particularly between Queensway, Mulford, and TOH. That's probably like 90% of surgical services to the region. At Cornwall and Pembroke and Hawkesbury would be the other three medium-sized sites. But part of this is a balance between giving people a break through the summer versus catching back up on surgery. And so what we're balancing again is this wellness piece. So come September, we have to give people a break through the summer. It's been a very long haul this last quarter. We'll ramp up some surgery, but once we get everybody back in September, we should be able to grow to about 110 to 120% of the surgical activity we were doing pre-pandemic, which puts us in the range of catching up probably depending on service, some services will catch up in 5 months. Others like cataracts, which we do 10,000 a year, it'll take us a better part of a year to catch up. And we'll titrate based on acuity and access. So there's definitely a plan that we have. I think the key that'll be with this, and this is why it's got to be done provincially, is how that's supported by government, both from a model perspective and a funding perspective. I mean, the whole recovery plan financially is going to be an interesting discussion and challenge with government. I think from what I've heard, they're headed in the right direction, but I think you'll see third quarter and fourth quarter will all be about trying to ramp up surgery. And as a province, I think it's probably across the country, but definitely in Ontario, we have to catch back up, which creates some innovative models of what we can do as well in terms of where we do surgery and how we do it.
What are some of the ways that have been used in the past, and now after the pandemic, we realize that we need to change those ways of doing things?
There's lots, and I think part of what we're going to go through over the next year is really looking at each one of those and how we capitalize. And you can't look at this holistically around what hospitals do or what long-term care centers do. You almost have to look at this programmatically based on what populations require for the health of that population. So, my AmCare example is a good one. If I look at surgical services, if you look at this region historically, a lot of patients that live in the outskirts travel into Ottawa to get their surgery. There are definitely models that we have put in place that I think you'll see expand, where if you have them integrated and surgeons are providing coverage in those outlying areas in an integrated model, there's lots of capacity and care that can be provided out in those centers, but you need a larger base of physicians. So if you're a small hospital out in the east or the west and you've got one general surgeon, or we've got 35 general surgeons, that one general surgeon will never provide 24/7 coverage, and they'll never do the type of subspecialization that the group does. If you twin them together, like we've done with Renfrew, now you can start to provide more complicated surgery in a safe manner in Renfrew that uses the capacity in Renfrew through the Renfrew Hospital, through an integrated medical model. So I think between surgery, mental health for sure. There are a number of things that have been done with OHTs, with community health centers, that we have to continue to capitalize on. Mental health needs I'd suggest to you that probably 30% of what we have admitted in a hospital today for mental health could be managed in the community if the community resource was available. And so from a patient perspective, they'd much prefer to be managed in the community. So I think there's an element here as we look to these OHTs and how we manage going forward. The community care sector has been instrumental through the pandemic in terms of starting to identify populations where they can play a very significant role, including primary care. So all that to say, I don't have, not unless there's a real specific question, I think as a generalization, the whole recovery plan from the pandemic is going to really take a look at what some of these new models have been rolled out and which ones get put in place. And that's not by organization, that's going to be probably led through Ontario Health or through the government.
Mm-hmm. Thank you. How do you find the right leader? What defines a right leader, and what are the characteristics of the right leader? The 1 million question.
Great question. So I'll tell you what I've always done and what we do now here. So I'd suggest to you that leadership within a culture and organization is built on a set of values and fit. It's not built on a high IQ. I've seen many leaders that have a tremendously high IQ and a very low EI and are not a good leader. I've seen the complete opposite as well. And so part of what we look for now is when we reorganized our senior team and our directors, part of this is we do a leadership review every single year on every single leader. We plot them on a chart between their potential and their performance and how we're going to support them in their leadership development. But the big piece we look at is their fit from a leadership aptitude perspective and their values. And if you find really strong leaders that have what I've described before, they can pretty much run anything. And so as an example, we have directors that run very large clinical programs that have no clinical background, none whatsoever. They're not a nurse, they're not a PT, they're not a doc, they're not an OT. They typically come through the MHA program, and they've got incredible leadership capability and have really driven an incredible amount of value within each of their service lines. The flip side is true, where we've got some tremendous nursing leaders that are running things like housekeeping, food services, and other non-clinical functions. And it's not because they're a good nurse, it's because they're a good leader. So a lot of what we hire first for fit and values, and then we take a look at whether specific skill sets are needed. So, if you're going to be a director of pharmacy, you kind of need to be a pharmacist, but it doesn't trump the values piece and your leadership capability. But a lot of the positions we have, you don't have to have an expertise in that particular area because you're leading people to drive change. You're not the content expert. And so that's typically how we've organized. And I think many organizations do it that way. Some don't, but we've had pretty good success over the years with that approach.
From a personal perspective, what are you most proud of, and what has been your biggest lesson learned that you will take with you post-pandemic?
Probably what I'm most proud of is just what this team, specifically to TUH, what this team has taken and done. Like, as I said before, the amount of, and I think part of it is culture of the organization, the willingness of people to just do the right thing and drop everything and step up and help has been incredible. And I'll give you a good example of this. When we had the last shutdown, which I lose track of time here, or whatever it was, when Directive 2 was issued about a month or two ago, we had to close down all of our elective services because we were growing. We went from 30 to 80 COVID patients in-house. We had 50 or 60 transferring into Toronto, and we did not have enough ICU nurses. So we put out a request to all those that we had ramped down elective activity of who would come and help in the ICU. We had 300 staff and leaders that were able to be redeployed. Only 4 refused because of personal related issues, and they were very valid. Everybody else agreed to help. When we did the long-term care piece, we had 100 people that would help in a nanosecond. And I think that's probably what is the most inspiring and gratifying, is people's true willingness to help. And I think the part of that is just the culture of this place. And so that to me is probably what I'm most proud of, is because quite honestly, without that, we wouldn't get through the pandemic as a community. Probably the biggest lesson learned is that, the relationships and the partnerships we have as a community between hospitals, community health centers, public health, there is a tremendous amount more we can do to advance care in this region. We're very fortunate. We have a very good healthcare system in Ottawa, Ontario, Canada. But when you look at the opportunities of what we've accomplished by working together, and there's lots of different ways to skin this cat, but when you think about where we probably need to go to advance care for patients and families in this region and what we can do from a research and an education perspective, there is a ton of opportunity. And I think that's a common thread across it. It is a 10-year transformation. That's where this new civic is so critical for us. it's about building a building. I mean, it'll be a spectacular building. It's the catalyst that drives some of the change that we need within acute care, within some of the integrated models I've talked about. It's a huge opportunity.
Outside of the clinical care focus, how have your leaders transitioned into the bimodal, remote and in-person working approach? How do you continue to maintain your company culture and employee involvement for those who are unable to work on site as a result of the pandemic to foster a productive and engaged workforce?
Yeah, it's a great question. I think this is something that all industries are going to have to reassess. So if I look at our shop, we probably have, let's say 1,000 people working from home, which are mainly around things like HR, finance, IS, research teams, analysts, our performance management group that deals with all of our data, those types of infrastructure. We've been having a lot of discussion on this. I don't think we're going to see ever a scenario where we're just going to bring everybody back. And I think there's 2 pieces to this. One is because to my point around wellness and work-life balance, there are a lot of people that really enjoy having the capability to be at home but they don't want to be at home forever. They may want to once or twice a week have some type of touchdown space. So part of our planning of the new Civic and what we're doing with some of our infrastructure is rethinking sort of this these office and touchdown space environments and how we create that infrastructure. Having said that, if you take a team like, I don't know, let's take health records and HR, if you've got 50 or 60 or 70% of your people at home, you still have to have team meetings. They still follow the same values. They still get treated no differently, whether they're at home or whether they're here, which speaks to how the leaders of those programs are going to engage that workforce. And so we don't have these pinned down yet. That's part of this recovery plan is when you take those programs and services, how are we going to revamp the model? But I can tell you unequivocally, a lot of those staff, we haven't lost a drop of productivity out of this, but the amount of engagement that's been increased because it gives them an easier balance, particularly if you have younger kids, it just gives them more capability. So we're going to try and capitalize on that for sure. And it's looking at each program, like finance is different than HR, it's different than IS, it's the same principle. And so part of the way my point before around what we look for leaders, yeah, the model may change of how they physically interact, but the leadership capability to engage that workforce is the same regardless of where they are. And remember, today we have staff on 19 sites today. So it's not foreign to us in terms of, and we're all corporate leadership. So our director of surgery has 6 sites now with staff on it, and then multiple managers and department heads, et cetera. So it's not foreign to what we do. It's another piece that we'll have to build into the puzzle.
The last question for today, and there are many more questions I would be happy to share with you separately, but we'll take this last question. In light of the pandemic and the uncertainty that surrounds COVID, risk management and mitigation strategies are increasingly important. So what's the role of the CEO and the senior leadership team in framing the pandemic response of the organization while balancing the risks to the organization, and when appropriate, risks should be brought forward by frontline leaders?
So we have, like most organizations, we have a well-established ERM, enterprise risk management framework and model. We've got internal auditors, we've got an internal control system, we've got an entire privacy team, and we've got a team that runs our entire enterprise risk management system. That enterprise risk management system is updated monthly, that identifies every risk to the organization through me to the board. And then we have to update the board bi-monthly or quarterly. So the pandemic, when it started, has been a bright red risk in the top right-hand corner. But so is about 4 or 5 other things around, financial sustainability and our research programs in terms of financial sustainability. So the pandemic is one of a number of risks that we assess on a quarterly basis. And then teams develop actions in terms of how we're going to mitigate those risks. And then it's reviewed every, as I say, it's either, depending on the risk, it's either monthly to quarterly that we review at the board. So it's not really a single shot discussion of whether it's in or not. It's embedded within a framework on how you manage the risk corporately, and the board holds me accountable for that.
Thank you, Cameron, for the insightful comments and information. I would like to thank you on behalf of all of us for taking time to be with us today. Again, I would like to reiterate that we appreciate all the work and all the backstage efforts that are being made to address the challenges that we are facing today. As I mentioned, I'll be happy to share with you the remaining questions.
For sure.
Have a great afternoon. Thank you all for your attendance, and thank you, Cameron, for spending the time with us at Telfer today.
Yeah, thanks for having me, Mirou. It's a pleasure.
Thank you.